Hey guys, this is part one of our just education on nurse provider rounding and IDT. And I wanted to start first with, we talked about the introduction to why we're doing this, but the other thing I wanted to get with you guys on is different parts of this process. So forgive me if I kind of look at my notes. I want to be sure I hit all the points. The first part of nurse provider rounding that involves the physician themselves is a short huddle with the charge nurse every morning. A lot of us probably already do this in some form, but this is going to be a defined process somewhere between 6 a.m. and 8 a.m. We have some folks like Dr. Middendorf who get there very early in the morning, so we didn't want to restrict it to a certain time. Some folks like to pre-round on the computer, so we didn't want it to be something where you showed up at 7 o'clock and hit the ground running. We wanted to have some autonomy for folks built in because we felt like that may have been a little of the feedback we got from CTR as to why that was a little difficult to implement. So we want to start the day with a short huddle or a short meeting with the charge nurse, and this is at the IDT board. When you come in, you can meet him or her there between 6 and 8 a.m. So what do we do at this short huddle? The purpose of this is to identify issues overnight that we need to address certainly early on, but then number two, also to kind of set up the day and the rounding that you want to do for the day, because that charge nurse is going to be in charge of cohorting patients, and I'll get to that in just a second. But when y'all meet, identify issues overnight that are patients that would need to be seen early, identify from the day before the discharges that you had on tap, which ones are continuing to be on process to be able to discharge, and then try to hit with that, are your 2 to 3 early discharges still in line to be discharged before 9:30? So by identifying those 3 categories of patients, then you can help the charge nurse then prioritize the folks that you want to see. Now, how does the charge nurse do this, or what have we asked of the charge nurse? We asked them to cohort patients or work with the nursing staff, so that a cohort means a group of patients that belong to one nurse. So we would like to identify the early discharges that you want and use that cohort of patients to see first. Let's take, for instance, Nurse A has 3 patients of yours, and one of those is the potential early 9:30 discharge. That would be a cohort of patients that then the charge nurse would help set up for you to be able to go see. And I will get back to kind of how that happens in just a second. Say, for instance, the next cohort of patients, there has been a patient identified that's having respiratory issues. And that may not even be an early discharge. That may be a cohort of patients involving Nurse B that has 4 of your patients. Well, that would be another early cohort that you want to see. So the ask would be is to identify, with the help of the charge nurse, the cohorts that you want to see first, and then go from there. So at the conclusion of this short meeting, you've identified the patients you want to see first, that cohort, 1 or 2 cohorts, maybe 3 cohorts you want to see first, and then the charge nurse can then group those up whenever you are ready to start your day as far as rounding. And I want to touch on this just a second. The other thing we found is that some folks round in different ways. So our idea with this is that there may be a doctor that likes to hit every cohort within an hour and a half or 2 hours. They go from cohort A, cohort B, cohort C, etc. down the road until they finish the whole floor in maybe an hour or 2, however they like to round. There may be another cohort like myself, or another provider like myself, that likes to see 2 or 3 cohorts, go write the discharges, write a few notes, and then get back with the charge nurse about the next cohort of patients to see. There may be another provider that just likes to see cohort A, go write a few notes, write a discharge, then see cohort B, write a few notes, write a discharge, etc. on down the line. There's some built-in leniency in how we want to do this process on purpose, so that we can work within several different models of how somebody wants to see patients. I will get in the next video into the details of nurse provider rounding. But this short huddle is meant to quickly give the charge nurse a time for you guys to communicate and set up your day a little bit with early discharges, as well as issues that need to be addressed pretty immediately when you get the floor, to hopefully then also cut down on some of the phone calls that may be occurring throughout the day as well. So that's the early huddle / touch base with the charge nurse that should occur between 6 and 8. Thank you.